The hip is a ball within a socket. You no longer have cartilage lining the head of your femur or the socket. And as a result, bone is rubbing on bone. And the net result are the symptoms with which you presented to me today. You're past the point of non-operative care. I asked you initially to use non-steroidal anti-inflammatories, to engage in recreational and fitness activities, to lose some weight. And now, no longer are you enjoying any benefits from the non-operative program. I want to talk to you today about total hip replacement. In a total hip replacement, the socket is reshaped, a metallic shell is placed into the acetabulum cup, and a plastic liner is positioned. In a total hip replacement, a stem is placed into the marrow cavity of the femur, a ball is placed on top of the stem, and your new hip joint is a ball on polyethylene or plastic. There are different types of bearing surfaces or weight-bearing surfaces that are employed in joint replacement surgery, but I think given your needs, metal on plastic would best serve your activities, your desires to be pain-free, and the high quality of life to which you wish to return. The blood loss is controlled by several means, including electrocoagulation. During the course of the hospitalization, you would go through the surgery and the rehabilitation with your stay in the hospital about 2 to 3 days on average. The 10 out of 100 patients require blood after a hip replacement, and we're asking you to donate a unit of your blood before the hip surgery. We do use special drains in conjunction with the surgery, which allow us to recapture your own blood and give it back to you. But it's still good practice to have blood available. In order to diminish the risk, the inherent risks of a joint replacement, you will be given antibiotic prophylaxis during the surgery and for 24 hours thereafter. And I'm going to ask you to use a blood thinner called Coumadin for up to 6 weeks to diminish the chance of developing a blood clot or to prevent it from traveling outside the leg should it occur. Now, in the real situation, there's obviously skin, muscle, normal ligamentous and capsular structures which protect the joint and keep it in place. And during the surgical exposure, these muscles are divided, moved to the side, the ligaments are transected, and we dislocate the hip to gain access to the ball and socket.